That was a video released by Stephen Twitch Boss 2 days before he walked to a local motel and killed himself. Millions were shocked. He had so many fans around the world. A new report was just released that Americans are rating their mental health the lowest we have in 20 years. I've talked about my own struggle, trying to deal with self-care, trying to acknowledge that health is health, mind, body, spirit, it all matters. And we have to keep the conversation going, and not just because it's the holidays. So let's bring in psychologist Dr. Jeff Gardere. It's good to have you, Doc. Thank you for being with me. Merry Christmas.
Thank you, Chris. Merry Christmas to you and your audience.
So Twitch was a shock because on Instagram, he was so happy, he was smiling, and everybody knew him that way. And meanwhile, there was another reality, which is a very common thing. Our digital life does not always reflect what's happening inside. What's the message for you?
The message is that depression doesn't have a particular face. We might see someone who is happy-go-lucky, has all the joy in the world, but inside what's going on may be completely different. They may be extremely depressed. They may be very isolated when they're not out in the public. We have to understand, Chris, that people have a brand, and when they're out there, that brand has to show them as being very joyful. But they don't particularly get the help that they need because they're so busy working, or they're so busy hiding, or maybe even masking that extreme depression and other mental health challenges that they may have.
I mean, look, that's a big motivator for me to go the other way. My brand is flawed and trying, you know, and for me, therapy was a must. I've been doing it for a long time. My therapist said, you know, I think that you need some medication to help you with some of the ups and downs you're experiencing. I bridled, you know, I bristled. I was like, I don't need that. I'm not crazy. And I was wrong, and it's helped me. And I'm not surprised by any of these numbers. How is your mental health? 31%. So 1 in 3 say excellent, okay? And you know half of them are making it up. But a little bit of it is perspective on yourself, so that's good. 44% say good. And then you have about 25% that say fair to poor. And, you know, what this touches on with me, Doc, I want your take on, we often don't know how we're doing. And that's why communication with the people around us is so important, right?
That's right. We have to absolutely stay connected. We need to be able to share a lot of the pain, not just the joy that we have with other people, because they really do give us a reality check. It's not surprising that an advisory board of medical professionals have said, listen, since COVID, we need to give almost everyone a checkup from the neck up. We're talking for ages of 8 to 18, screening for anxiety, from 12 to 18, screening for depression, from 19 to 64, looking at people with regard to anxiety. So this mental health tsunami that has come from COVID must be addressed. And that's what we're finding with the numbers, Chris. As you know, more people now who are suffering with some mental health challenges, just like you, are seeking help. And you are a role model, and we need more role models out there to say, you know what, it's okay to not be okay, but it's not okay to not do something about it.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.